What are the top 3 or 4 reasons for erectile dysfunction?
Sure. So the top reason for erectile dysfunction is a decrease in the health of the circulation of the penis. So a decrease in blood flow, because an erection is a hydraulic event. Enough blood has to flow in at a high enough pressure that it expands the penis and makes an erection. And while expanding the penis, there's this mechanism where once the pressure is high enough inside the penis chambers, that they kind of squeeze close the veins so the blood gets trapped in there, and then you have the erection. And the tissues, the blood vessel tissues, have to be healthy enough for all of that to happen. So the leading cause is a problem with the circulation, the health of the circulation. And most commonly, it's going to be the result of age-related changes. As we get older, our blood vessels gradually age and deteriorate, but the way we take care of ourselves, the exercise, the nutrition, and also some good luck with our genes, to be sure, helps us have better or worse circulation for a longer period of time. And so a man at 50 might start to notice a decrease in his erections because his total circulatory system is showing signs of age-related changes. But another man at 50 may have no issue at all because a combination of his lifestyle choices, as well as his general state of health, has not resulted in the same deterioration of his blood vessels at that time. Go forward 3 more decades to 80, most guys in their 80s are going to notice some changes in their erections, and more severely, because at the end of the day, we are not immortal, and the majority of us will begin to succumb more and more as the years go by. But there are other conditions.
May I just ask about, follow up on that? So one thing that I notice is that when a man might have erectile dysfunction and he goes to the doctor, does the doctor say, just focus on the penis, or does the doctor look at the whole system and go, you need to start changing your diet because you might have a heart attack? Is it a canary in the coal mine for heart disease and things like that?
Yes, it is, because, obviously the heart is the centerpiece of our circulatory system. And so disease in the blood vessels of the heart, coronary artery disease, are going to be part and parcel of disease in any other parts of the circulatory system. And the penis's blood vessels are much narrower, they're much smaller than the blood vessels around our heart. And so when we get disease in our blood vessels, the penis will demonstrate signs of it earlier than the heart. So a man will get erectile dysfunction a few years sometimes before he gets his first sign of heart disease, which could be chest pain, or sometimes the first sign of heart disease is sudden death. And we in the medical community have become very attuned to that. And so, yes, when a man presents with erectile dysfunction, doctors are sensitive to think, okay, how is the rest of his circulatory health? What is his lipid profile? How's his cardiovascular health? What's the EKG look like? What's the labs look like? And that is an important signifier. And so if a man comes in with erectile dysfunction and he has not had any kind of other health checkup or monitoring, it's important that that is addressed as well. Other causes of erectile dysfunction, if a person has a disease state that is bad for the circulation, that can cause erectile dysfunction even before that person has age-related changes. So, for example, men with diabetes, with poor control of their blood sugar, that wreaks havoc on the small blood vessels in the body, including the blood vessels in the penis, and that can be a cause for erectile dysfunction. And it's because of the effects on the blood vessels. But another thing that diabetes affects is nerves. And it can affect the nerves to the penis because the nerves of the penis are also critical for erections. Nerves release a signal, which is nitric oxide, onto the blood vessels of the penis. And then the nitric oxide allows those blood vessels to open up and let the blood rush in. And so other men may suffer from erectile dysfunction due to specifically nerve damage, a spinal cord injury, or a man may have had to have surgery in his pelvis near where those nerves of the penis go, maybe for colon cancer, maybe for prostate cancer, maybe for some other spinal condition. But fortunately, most abdominal surgeries and most pelvic surgeries don't get near to those nerves. But nerve disorders is another known cause of erectile dysfunction. Medications that we have to take sometimes for high blood pressure can interfere. Some of those medications can interfere with erection, some don't. Medications we might have to take for mood control, for depression and what have you, sometimes can have effects. And then a very common cause of erectile dysfunction in younger men who don't yet have any disease going on in their blood vessels or in their nerves is performance anxiety. And this is a very common cause of erectile dysfunction in younger men, and it can be an added layer of the problem in older men who have some degree of a physical cause, but then it can be aggravated by the performance anxiety component. Performance anxiety is a real thing, and it has a physical underpinning. And what that is that when a man is anxious about his sexual performance, his body will release adrenaline. We release adrenaline to cope with a stress. That's our body's defense mechanism. And that stress might be a grizzly bear is charging at you, or it might be concern that you're going to have difficulty getting an erection. Either way, the body still releases adrenaline. The body doesn't distinguish which kind of defense it needs to provide. It provides the same defense to you, which is adrenaline. And adrenaline prepares you for some kind of impending physical danger by shunting blood to your heart, your lungs, your brain, your core, and it draws the blood away from the parts that you can live without, your fingers, your toes, your penis. So when a man is experiencing an anxiety over his sexual performance, he physically releases adrenaline, which physically shuts down the blood flow to his penis, making it hard for him to either get the erection or keep the erection. And the problem is that this has a snowballing effect, because then the next time he goes to have sex, he's going to think, I wonder if I'm going to have trouble like I did that last time. Boom, adrenaline, boom, even worse. And it just becomes a vicious cycle. And it can be very hard to get out of that vicious cycle, because it's very hard to tell yourself, don't think about that, or don't worry about that. And so that is a very real and profound cause of erectile dysfunction, typically in younger men. And the underlying trigger for that may be, the guy had a bad cold, or he drank too much, or something threw him off, but then he thought, oh my God, this has never happened to me before. Something must be wrong. Uh-oh, what if this happens again? And then boom, he's down the path of performance anxiety.
So what do you say to to him that comes in? It seems like it would be some kind of meditative emotional therapy, which you don't generally want to do right when you're trying to perform with the hot lady. So
behavioral therapy is key here. And so I work with a behavioral therapist who specializes in sexual health. And that person works with the guy, with his partner, or with a couple. And in addition to that, we can use medication to help as a bridge. So fortunately, pills such as Viagra, also known as sildenafil, Cialis, also known as tadalafil, these pills are very safe. It's rare that they're of any risk. In fact, the only real risk is if they are combined with nitroglycerin, which very few men have to take, and certainly not in this age range. And what happens when you take one of these pills is that it causes the nitric oxide that is being released by the nerves into the penis to basically get turbocharged, to accumulate more than normal. And that increases the blood flow to the penis over and above what it normally would be able to do. And so when a man has performance anxiety and he takes these pills, even though the adrenaline is trying to shut off the flow of blood to his penis, these pills are counteracting it and increasing the flow of blood to the penis, allowing that man to have a successful sexual experience. And they can take these pills for quite some time with no health risk and build up a positive reinforcement over time. And then they can sort of forget to be anxious at some point. And you take that and you couple it with behavioral therapy, which is techniques about how to perceive yourself, your partner, what the whole role of sex is, and kind of take it down a notch, if you will, and be able to relax more about it. That combination approach is typically what I will provide for these guys.
Where does testosterone fit in here? There are a lot of ads about, do you have low T?
So testosterone is a critical component of erections. I mentioned circulation, I mentioned nerves, and then the other piece, or another piece, is hormones. And so it is important for a man to have a normal level of testosterone to have normal, healthy erections. Testosterone is important for the desire for sex. So in the brain, it triggers the desire for sex, but it also helps facilitate the erection happening. And it's important at the level of the health of the blood vessels in the penis. So the blood vessels in the penis will be more or less robust if there's normal levels of testosterone or not. And testosterone is usually normal in younger men, but as men age, their testosterone levels do decline. Now, the majority of men will still have normal testosterone as they go through their 40s and 50s and 60s, but a surprising number of them will start to decline below normal. And they'll notice a decrease in their erections, in their sexual desire, and other aspects that testosterone is important for in men, such as their physical strength, their stamina, endurance getting through the day, mental focus and clarity. It also is important for things that they can't know about or feel, which is like their bone density and preventing them from getting hip fractures when they're older, when they fall down, keeping those bones strong. And in some regards, important for the immune system. In fact, if a man has low testosterone and doesn't treat it, he may expect to have a shorter lifespan. Testosterone also helps with sugar control, with control of blood sugar if you're a diabetic or even if you're not. And it doesn't really have any risks with regards to cardiovascular health. There is some fear out there about testosterone might be bad for your heart, but really that was based on some clinical studies that were poorly designed. So testosterone is an important hormone for men, and it does decline in many men, and replacing it can restore some of these bodily functions, make them better. Now, we are mortal. At some point, we will wind down, but we can turn back the clock a little bit if our testosterone has started to dwindle with testosterone replacement therapy done under medical supervision. And it can help some men restore their erections. But I will say this, there are many men who have low testosterone and poor erections. And for them, testosterone is not the only piece of the puzzle. Mm-hmm. They also still may have poor circulation or nerve issues for which they may still also need medication in addition to testosterone. But for others, it's just the testosterone alone. But you don't know that you have low testosterone unless you get blood tests to check. So it's not wise to think, I think I got low testosterone, I'm having trouble with my erections, or I think I got low testosterone, I just don't feel like I used to. And then go find, the guy at the gym that's the hookup and get started on testosterone. Not wise. Couple reasons is it's not a zero risk treatment. Mm-hmm. Secondly, in many cases, guys think they have low testosterone and they really don't. Their testosterone is normal. It's other stuff going on. And when you go on testosterone, it shuts yours off. So your testosterone production shuts down, goes into hibernation. Now it can come back, but it can take up to a year to come back. And sometimes it doesn't. And that's a bad trade if you didn't need the testosterone in the first place. And furthermore, if your testosterone level is normal and you boost it higher, in the vast majority of cases, you don't feel any better. You don't have better erections. You don't feel more sexual. If it's low and you boost it up in the normal range, absolutely you notice a difference. Mm-hmm. But for many men who are already normal, thinking that testosterone will make them Superman, it really doesn't.
Yeah, it's so important with hormones or really any minerals, vitamins, everything, to just make sure that you get a blood test first. I learned that with iron as an athlete. It's like, oh, iron's good, more's better, take iron. But more iron can be dangerous, and iron oxidizes in your bloodstream, and that can be quite dangerous. So get the blood test. You mentioned Viagra and Cialis and how safe they are, which is awesome to hear. And I know that they help to give an erection, but they don't really help to arouse. So I'm curious if there's a Viagra for women and if it works any differently, because as women age, the arousal is sometimes more of the problem than the orgasm. It's almost the opposite, I would say, with some of with guys' problems. Is there anything like a Viagra for women?
Well,
what does it do?
I am not a female sexual health expert, but I'm aware of a medication called flibanserin.
Okay.
That's the generic name for it. And it is touted as sort of a female Viagra, if you will. I believe it does help with sexual desire in some women, but another factor may be also hormonal balance too. And after menopause, there is a change in the hormonal balance. And for some women, having their hormones rebalanced can help with that. But I'm certainly not qualified to talk about that in any real detail because it's just not a part of my practice.
Yeah. But it's good to know because we can go to see
you can speak to your
and
gynecologist.
I just didn't even know if there was anything at all. So it's good.
And some gynecologists subspecialize in female sexual health in particular.
Okay.
Many don't. So you might have to, take it to an additional level of expertise to, fully get your answers or your remedies.
Right. Yeah.
Before we go off to other issues with the penis, I wanted to just ask another question about erectile dysfunction. I remember in the 80s, I'm old enough to remember that when Bob Dole and Viagra came around and Bob Dole was promoting it and so many people, it became so successful. And I remember being shocked that so many men had this issue. And even now, 30 years later, I've always thought that it was a lifestyle issue, and that in other countries where they might eat a lower fat, more whole food, plant-based diet, the men might not have it. But then doing research for this show, I realized that all the shark fin soup and all the aphrodisiac kind of things that other countries, Asian countries, where we look at them as eating a much healthier diet, they're also looking for remedies for either arousal or performance. And can you talk a little bit in terms of percentages of men who this is affecting, and is it aging? Because you said it's aging, and I always thought that it wasn't aging, it was our Western lifestyles.
Right. So it's both, because we're not immortal, right? At some point, we will age out.
Right.
At some
I guess
point,
I didn't think maybe that didn't, I thought that would still work maybe.
Well, there is the Die Hard movies, but aside from that, there are men in their 90s who have normal, healthy erections. That exists, but that is the exception rather than the rule.
Okay.
So given that our bodies are going to gradually deteriorate as we age, including our circulatory system, we can slow that down with our lifestyle. So yes, I do agree that lifestyle is an important component to sexual health, but it's going to be used to slow down changes over time. And perhaps you will slow them down sufficiently to where you may live your whole entire life with normal sexual function. But if you don't, it's not necessarily something that you should blame yourself for. That, oh, I did it wrong. Why do I have this now? I must have done it wrong. So it's a balance. But to be sure, the better we can be with our lifestyle choices, the better we'll go through this life. And whenever our time is up, whatever the cards have in store for us, we'll live it better. We'll live it stronger. And same with sexual function. But to answer the question of the prevalence of erectile dysfunction, studies have been done on this, and about 50% of men by age 50 have some degree of erectile dysfunction, usually on the milder side. And with each passing decade, it goes up by 10%. So 60% at 60, 70% at 70, 80% at 80, 90% at 90. And the severity of it gets worse and worse. So mostly mild to moderate in the 50 plus population, much more severe in the 70 plus population. And that's how to understand it. Now, there are populations around the world that have been examined where they eat predominantly plant-based diets, such as like the Mediterranean diet. And when you look at the incidence of erectile dysfunction in those populations, they are lower. They are having better erections into their old age, and it can be correlated to diet. So yes, even though men around the world seek treatment for erectile dysfunction, some men are doing better than others, and it can be correlated to their dietary choices.